as they now get seated on the stage. Distinguished dignitaries on the stage are very respected delegates, respected members of the press and media, ladies and gentlemen. A very warm welcome goes to all of you attending the ministerial meeting, Sustain, Accelerate and Innovate to End Tuberculosis in Southeast Asia region. I now have the privilege in inviting Dr. Poonam Khetrapal Singh, Regional Director, WHO Southeast Asia, for her opening remarks, please.
Director General WHO, Dr. Tedros, Honorable Ministers of Health, Regional Director, Euro, Dr. Hans Kluge, distinguished partners, civil society representatives, welcome to this high-level meeting to end TB, which we embark on just 1 month before the second UN high-level meeting on TB, which is a tremendous opportunity. I express my sincere gratitude for your presence and my utmost thanks to community representatives who are not simply the heart but the voice of our TB response. Today, we choose courage, hope, unity, and action. We renew a bold yet attainable vision. A Southeast Asia region where TB is no longer a public health problem, menacing millions of people with disease, death, poverty, and despair. And we take not 1 or 2, but several steps forward in a journey that began in 2017 when Excellencies, our Ministers of Health from our region, made ending TB our regional 8th flagship priority, which was renewed in 2021 when high-level leaders unanimously adopted a new regional strategic plan towards ending TB. At the first UN high-level meeting on TB in 2018, Indian TB survivor Nandita Venkatesan made a simple yet urgent plea. For political leaders, policymakers, donors, and all other TB stakeholders globally to act now without delay. That urgency was embedded in the resulting UN political declaration on the fight against TB, which identified a series of global targets. That is, by 2022, to successfully treat at least 40 million people with TB, including 3.5 million children and 1.5 million people with drug-resistant TB, and at least 30 million people placed on TB preventive treatment. By 2021, the Southeast Asia region had achieved 67% of its apportioned target for treatment overall. 56% of its apportioned target for treatment of children, 50% of its apportioned target for treatment of drug-resistant TB, and 20% of its target for TB preventive treatment coverage. However, as a region, on 3 of the 4 UN HLM targets, we outperformed. Notably, we expect the latest data, which will be released next month, to highlight significant region-wide advances, with several high TB burden countries expected to have initiated more people on treatment in 2022 than in 2019. In other words, together we are bending the curve and must now accelerate momentum, shaping history to our will. For that, in the lead up to the second UN HLM, I have 4 requests to make. First, that at this meeting and beyond, we cultivate the highest level of political and operational commitment. Commitment not at one level or in one sector, but at all levels and in all sectors. Specifically, I urge leaders from each country to establish a high-level multi-sectoral commission on TB, which could also help build health systems resilience and advance universal health coverage and health security. Second, we must actively accelerate access to new TB tools, technological and treatment regimens that are people-centered and which are delivered at the primary healthcare level within the community. For this, I urge you to share experiences and lessons learned and agree on concrete measures to strengthen South-South collaboration with a focus on facilitating affordable national procurement. Third, let us allocate adequate and sustainable domestic resources to meet TB service coverage targets, building on the sustainable increases already achieved. In 2022, TB allocations in the region reached $1.4 billion, of which 60% was from domestic resources. However, for mission success, we need at least $3 billion annually, which will also help maintain key social protection programs such as for nutritional support. Fourth, we must continue to engage and empower TB-affected communities, not just listening to, but truly hearing them. On this, let us agree. In 2018, at the first UNHLM, action was needed without delay. Today, it is needed more urgent than ever. Together, let us seize the moment. Let us end TB. Thank you.
Thank you very much, ma'am, for your opening remarks. Ladies and gentlemen, it is now my privilege in requesting Dr. Tedros Adhanom Ghebreyesus, Director General of World Health Organization and co-chair of this event, for his inaugural keynote address, please.
Thank you, Madam Moderator. Sorry. Your Excellency, Dr. Mansukh Mandaviya, Minister of Health and Family Welfare of India, Excellencies, Ministers, and my RDs, Dr. Poonam and Dr. Hans, Excellencies, dear colleagues and friends, Namaste, and good afternoon, and it's an honor to be here with you today. And I thank India for hosting this very important gathering. With almost half of the global TB burden, nowhere is the fight against TB more important than here in the Southeast Asia region. And here in India, a country with one of the highest burden of TB, I applaud the leadership of the Honorable Minister, the Honorable Prime Minister Narendra Modi, and the effort of the Minister with their commitment to end TB. India has ambitious targets backed by a substantial increase in domestic funding and implementation of innovative approaches and multi-sectoral action. This provides inspiration to other countries and leaders to prioritize ending TB. I would also like to acknowledge key partners represented here today, including the Global Fund, USAID, CDC, Bill and Melinda Gates Foundation, FIND, civil society organizations, and others. We need all hands on the deck to end TB. This is a disease that afflicted humanity for millennia and remains one of the world's top infectious killers. TB kills 1.6 million people each year and affects millions more, with enormous impacts on families and communities. Over the past 2 decades, we have made significant progress in the fight against TB. Since 2000, 74 million more people are able to access TB services. However, major disruptions from the COVID-19 pandemic and other global crises have reversed progress in many countries, including in the Southeast Asia region, causing a drop in the number of people able to access diagnosis and treatment. In the Sustainable Development Goals, countries committed to the target of ending the global TB epidemic by 2030. It's an extremely ambitious but achievable target. We have new and powerful tools to do it, including rapid tests, which reduce testing times from 3 days to less than 2 hours, and new oral treatment regimes for drug-resistant TB that reduce treatment times from 18 months to 6 months. These are game changers for diagnosis and treatment, and both are now becoming widely available in more than 100 countries. But there is one important tool we still need, and that's a new vaccine. The only licensed TB vaccine, BCG, was developed more than a century ago. It saved thousands of lives every year by protecting young children, but does not adequately protect adolescents and adults, who account for most TB transmission. That's why earlier this year, WHO also established a TB Vaccine Acceleration Council to facilitate the development, licensing, and equitable use of new TB vaccines. The Council will work to boost the TB vaccine pipeline and facilitate the licensing and use of safe and effective TB vaccines through partnership-based innovative solutions to close critical gaps in knowledge and financing. The COVID-19 pandemic demonstrated what's possible, that with political and financial commitment, new and powerful vaccines can be developed quickly and distributed widely. TB is a different scientific challenge to COVID, but where there is a will, there is a way. As is the case for so many health challenges that afflict the world's poorest and most vulnerable, the key challenge we face is one of political commitment. That's why the second high-level meeting on TB at the UN General Assembly next month is so important. WHO is calling on world leaders to commit to concrete targets for the next 5 years. First, to reach 90% of people with TB prevention and care. Second, to use the WHO recommended rapid test as the first method of diagnosis. Third, to provide social benefit packages to all people with TB so they don't endure financial hardship. And fourth, to license at least one new TB vaccine. To accomplish these goals, we need to close the funding gaps for TB care and invest in research and innovation. At the same time, we need to address the drivers of TB: poverty, malnutrition, diabetes, HIV, tobacco and alcohol use, poor living and working conditions, stigma and discrimination, and more. I created the Civil Society Task Force on TB to advise us on addressing these issues. I'm pleased to see some members of the task force present here. Today's ministerial meeting is vital for ensuring highest level participation from countries to work closely with civil society, communities, and other stakeholders to contribute to re-energize commitments to end TB. My thanks once again to the Government of India and to all countries of the Southeast Asia region for your continuing commitment to the fight against TB. And finally, I would also like to thank and express my respect and appreciation to my sister, R.D. Poonam Singh Khetrapal. Together, we can turn the tide against this ancient killer. Bahut Bahut Dhanyavad. I thank you.
Thank you very much, sir, for your wonderful inaugural keynote address. Ladies and gentlemen, it is now my privilege and indeed an honor in requesting His Excellency Dr. Mansukh L. Mandaviya, Honorable Union Minister of Health and Family Welfare and Minister of Chemicals and Fertilizers, Government of India, co-chair of this event for the inaugural keynote address, please.
Thank you. Present on dais, Mr. Jahid Malik, Excellency Health Minister of Bangladesh, Rionpo Daso Dechen Wangmu, Excellency Health Minister Bhutan, Kehlia Rambuk Pela, Excellency Health Minister Sri Lanka, Mohan Bahadur Basnet, Health Minister Nepal, Safia Muhammad Said, Deputy Health Minister Maldives, Dr. Tedros, Director General World Health Organization, Hans Henris Koch, WHO Regional Director Europe, Poonam Khetrapal Singh, WHO Southeast Asian Region. Namaste to all. Good afternoon. Welcome to the ministerial meeting, Sustain, Accelerate and Innovate to end TB in the Southeast Asia region. I thank all of you for joining us today to discuss the important agenda on combating tuberculosis. This year, we observe World TB Day. At the One World TB Summit in India at Varanasi, Uttar Pradesh, essentially highlighting the ethos of One World, One Health that our Honorable Prime Minister strongly believes in. Excellencies, India has been at the forefront of the response to the global public health challenges posed by tuberculosis. Under the dynamic leadership of our Honorable Prime Minister, we have committed to eliminating tuberculosis from India by 2025, which is 5 years ahead of the target to the global SDG goal. Following this commitment, India strengthened the approach towards TB elimination and made tremendous efforts. In this regard, I am proud to highlight that India leveraged the power of data-driven decision by developing its own mathematical model to estimate tuberculosis burden using local evidence. Through its dedicated efforts, India has achieved a 13% reduction in TB incident and 15% decrease in mortality from 2015 to 2022, performing better than global average. Excellencies, to identify all missing cases by reaching the unreached and ensuring universal health coverage under the leadership of our Honorable Prime Ministers. India established our 1.6 lakh health and wellness center. Yesterday, Dr. Tedros visited to Health and Wellness Center. They provide tuberculosis detection and treatment services to all patients, along with a host of other primary healthcare services. Private sector engagement and sustainable models, the notification of tuberculosis has improved by as high as 7 times in the past decade. Excellencies, it is unfortunate that the stigma against tuberculosis is still prevalent in our societies. Therefore, India has been committed to providing enabling and patient-centric support to all individuals suffering from tuberculosis. During the One World TB Summit, the Honorable Prime Minister launched a family-centric care model which takes into the consideration the social aspects of the disease and the positive role that families play in TB recovery. India also implemented a first of its kind community engagement mechanism to combat stigma and mobilize people from all walks of life to support those on TB treatment. Honorable President of India launched the Pradhan Mantri TB Mukt Bharat Abhiyan in September 2022 to provide a supportive environment to all patients in the country. We called upon individuals, elected leaders, political parties, corporate ministries to work with the TB patients in the treatment journey by becoming Nikshay Mitra and provide additional nutritional, diagnostic and vocational support to them. Excellencies, through Jan Bhagidari, means people's engagement approach under Pradhan Mantri TB Mukt Bharat Abhiyan, we are raising an estimated $146 million in a year to address the problem of undernutrition. India established a social support scheme, Nikshay Poshan Yojana. This initiative provides monthly nutritional support to those on TB treatment through direct benefit transfer. I am happy to highlight that since 2018, over $244 million has been transferred to the bank account of 7.5 million TB patients. The ration trial, which got recently published, validates the importance of nutrition in reducing TB mortality as well as incidence. Although vaccine development is underway, we must fast-track our efforts, drawing lessons from the COVID-19 pandemic. Excellency, collaborative efforts and equitable access to diagnostic, prevention and treatment options are pivotal to ending TB as demonstrated by the pandemic. India is committed to sharing its learning with the world and learning from other contexts as well. I strongly believe that with our continued effort, and determination, we can eliminate TB from the world before 2030. This is an important year for the world, as we will gather again at the UN high-level meeting on TB in September. It will be a chance for us to reckon with the collective progress made towards the ambitious target set to end tuberculosis. Collective and collaborative efforts within Southeast Asian region countries would be a key to ending tuberculosis. Thank you. Thank you very much.
Thank you very much, Your Excellency, for your most wonderful inaugural keynote address. Thank you, sir. I now have the privilege in inviting